What would they do if they had the chance to relive their lives again? What would you do?
This is Dr. Tori with RookieDoctor.com. It's time for another issue of Residency Horror Stories. And this one occurred during my internship. Now, I had a patient who was on respiratory isolation they were being ruled out for tuberculosis. So they were getting the standard AFB in the sputum times 3 kind of thing. And until they had 3 samples back, they had to remain in the respiratory isolation room. So it turns out I saw the patient 2 days in a row, and then on the 3rd day I come back up to his room, and I walked into his room and I noticed he had the covers sort of like pulled right up to his nose, and all I could see were his eyes. And I introduced myself again and started talking to him, and I noticed he just kept the covers up there, and he just seemed really down while he was talking and all these things. So I pulled up a chair, and I pulled it right up next to his bed, and I put my hand on his arm that I could see through the covers, and I just sort of rested my hand there, and I said, Mr. Jones, it's time for us to have a heart-to-heart. We're looking at a pretty tough situation here. Your CD4 count, as you know, is less than 2. You've come into the hospital several times in the past month or so with infection after infection, and and it seems that it's catching up with you, and I just want to talk to you about your feelings and let you know that it's probably time for you to start getting things in order. And he said, I understand, but he still kept the covers up to his nose. So I went on to say that we're looking at weeks to months and not months to years for the rest of your life. You failed the highly active antiretroviral therapy. You failed several various types of treatment, even some in the experimental realm, etc. And you just keep getting these opportunistic infections, and so like time is limited. So while I'm having this heart-to-heart with him, telling him that he's dying, a phlebotomist knocks on the door, walks in with his, phlebotomy tray, and says, Mr. Williams? And the guy goes, yes, and he pulls the covers down, only for me to see that it wasn't Mr. Jones, it was Mr. Williams. So I just told the wrong guy that he was dying. Now, oh my gosh, can you imagine what I was feeling, right? So I told the wrong guy that he was dying, and I just said, excuse me, sir, I'm going to let him draw your blood. I'm going to step out, and I'll come back in a few moments to pick up where we left off. And I went, first I was angry, right? So, well, actually, first my stomach was somewhere around the floor. And I thought I was going to be incontinent or vomit or something. And but then second, I got angry, and I thought, who moved my patient? Like, what's up with patients moving? I mean, you don't have to tell the doctor. Like, I'm the main guy that's been seeing this patient. So I went out there to try to find his nurse, and then I calmed down by the time I found her, and I said, what happened to Mr. Jones? He was in 741, and now it's someone else. And she goes, yeah, he ruled out, for TB, so we moved him to a regular room. He didn't need respiratory isolation anymore, so we were able to put someone else there. And I just hung my head low. I shimmied over to the chart rack, and I pulled out the chart of the guy that I just told who was dying. And it turns out that his CD4 count was less than 2. And it turns out that he had been hospitalized several times with opportunistic infections. But so at first I breathed a sigh of relief. Then I called his intern and his upper level resident and said, look, I just had this conversation telling this guy he's going to die, and I meant to be having it with my patient, so I really apologize, but it looks like it was an appropriate conversation. And the intern said to me, whew, oh man, I didn't know how to break that subject with him. I didn't know what I was going to do. I'm glad you sort of said that. So I had to go back and just sort of tell him, although I'm not your doctor, it's important to think about these things as the possibility of opportunistic infection catches up with you. So a few lessons to extract. Now, that's a horror story because for about 10 minutes, it was complete, sheer, utter horror for me. So there are a few things to extract from this. One, patients move. You know, for various reasons. It might be that one patient is a little confused, so they move them a little bit closer to the nurse's station and switch your patient's room. It might be that you know, someone gets admitted that they just want to put the nurse's patients closer together so that the nurse doesn't have to go, you know, halfway across the unit each time she wants to see one of her patients. Um, and you know, so there's various reasons why a patient might move. They might no longer need telemetry, and then the nurse might say, oh well, you don't need telemetry anymore, and call an on-call doctor or something to have the patient moved so that a crowded emergency room can have a patient come up to the telemetry floor. So there are many reasons why your patient will move, and the point here is that actually several points. The first is that when your patient moves, it's very important not to refer to them as a room number. It's very common for nurses to refer to patients as room numbers and doctors to refer to patients by their last name. Both of those are dangerous, actually. You should use both, and you should use the first and last name because names are common and names can sometimes be mixed up or sound similar, and then also rooms move. So use both. Beware that when you're talking to a nurse, he or she might be using the room number and they might be talking about a completely different patient. Also be aware that when people identify patients by their last name only, a similar name can be mixed up. The second lesson to extract is that now there are protocols, and you're going to think it's completely stupid if you go into the operating room. Why do we always have to look at the bracelet and this and that? I just talked to the man, blah, blah, blah. Well, guess what? You do have to look at the bracelet. You do have to confirm it with the patient. You know, patients are nervous. So when they're sitting there in bed, sometimes, and somebody comes in and they say, you know, Mr. Bunyik, and really their name is Johnson, well, they'll just answer because they think, you know, well, what's this guy going to say to me? You know, who is he and why is he here? And maybe he's just going to tell me like what's on the dinner menu, or maybe he's going to tell me that, you know, well, we have to move your room, or cetera, et cetera. You know, so they're not necessarily, not all patients are savvy enough to know that their answering to any old name could be a cause for error, and they also may not have heard you. So use the armband or whatever patient identifier the hospital uses. Make sure you ask the patient and confirm it. So those are two big lessons. Don't refer to patients by room numbers or just last name alone, and make sure you look at their patient identifiers, their wristband, etc. Now, another lesson to extract from that is that sometimes you have to have the hard conversation. And when you do it, um, let them know with your body language that something has changed. In other words, if I walk in there and say, you know, oh, it looks like your liver tests are improving and this and that, and I'm just standing at the bedside talking to them, that's one thing. But when I sit down, pull up a chair, put my hand on his shoulder or on his arm and say, it's time for us to talk about something important, or let's have a heart to heart, or something like that. It lets them know the gravity of the situation. It prepares them. Okay, so use that. Make sure you're aware of your body language in the bedside. So anyway, that's a horror story. I mean, you may not think that's a horror story, but I'll tell you what. It was sheer horror when that patient pulled his covers down and said, you know, answered to, you know, to a name that wasn't the name I thought he was. So anyway, there you have it. I hope you can take some lessons from it, and that's it.